This is Akashvani. In the program Spotlight, now we bring you a discussion on steps to stay safe amidst rising air pollution. The participants are Dr. Pavan Kumar, respiratory specialist, Ram Manohar Lohia Hospital, and Lalima Anija Dang, anchor.
Environmental pollution. Well, these two words are no more just limited to high-end conferences alone. The issue has been affecting the common man in many ways, more so in Delhi, especially in the winter season. Of course, policy decisions like replacing fossil fuels with electric vehicles and renewable energy will take some time to manifest. These issues have been a matter of discussion even at the G20 forum. Welcome to Akashvani, Dr. Pavan Kumar.
Thank you, ma'am.
Sir, there's no doubt about it that there is a cocktail of gases that we are all inhaling in Delhi. How can we cope with it?
During this season, definitely there is an increase in the level of pollution because of multiple reasons. And many studies have been done on air pollution in the past also, and some studies might be going on. What happens from all the studies, they show that there is a adverse effects on the health of all people, of all age groups. And there is a ill effect on the respiratory system, cardiovascular system, and other on our mental state also. So to cope up with this situation, we should protect whatever measures we have got, be indoor as far as possible and wearing of the mask. These are the measures which a person can do. And we can teach people to go in a vehicle on a sharing basis, use public transport as far as possible. And other measures which increases the pollution level, they should be curtailed. These are the things which we can do.
Dr. Pavan, do you see an increase in patients regarding respiratory tract infections when the pollution levels go high? Because right now in Delhi, we are kind of trapped, and it happens almost every year. It's a yearly phenomenon that maybe because of Parali, maybe because of other factors like vehicle pollution, that the air is trapped, the air is not moving. And so we are kind of trapped in this whole cocktail of gases. Do you see a rise in the number of patients with respiratory problems?
Yeah, basically during this season, definitely in our hospitals, the persons with having respiratory complaints, they increases. People and number of people with having cough, having chest discomfort, having burning eyes, and increasing sputum production. All these symptoms, they come with these symptoms in the OPD. Definitely there is an increase in the number of patients.
And do you think there are some special vulnerable groups like people suffering from asthma or pregnant women, old people, infants? Do you think there is a category of people who are more vulnerable to respiratory problems when the pollution levels go up?
Definitely, people of all age groups are affected with the pollution. There are some vulnerable populations, like in the extreme of age, like the infants and the old age, and some group of people who are already having some comorbidities like bronchial asthma, COPD, and other respiratory problems. They are already harboring the respiratory problems. So, and when they are exposed to such a high level of pollution, these problems get aggravated by the exposure of high level of pollution.
Doctor, one tendency of many people in India especially is to take recourse to antibiotics at the slightest, when they're comfortable, when they are reaching a certain level of discomfort, they say just pop in antibiotics, and we don't have a system where the chemist will say no to antibiotics if it's without prescription. What do you have to say to that? Because now the reports that are coming in is that Indians are becoming very resistant. Many of our problems are becoming resistant to antibiotics because of the frequent use. What do you have to say on that, doctor?
If I talk about this season and the problems which most of the people are facing because of the high pollution, it is basically because of the exposure of the irritants. Like we have the different particles in the air pollution, like PM 2.5, ozone, and other sulfur dioxide. There are multiple carbon also there. So they are irritant to the airways. When they inhale these particles, they irritate the mucosa and they penetrate it deep inside the lung. The smaller particles, they penetrate more inside the lung. They be more and more deeper, and they go into the blood also. So what happens, the role of in these scenarios, we have the role of antibiotics are not as such recommended because it is not effective etiology. Secondly, to the air pollution. So we should not misuse the antibiotics. If anyone who is getting any problem, respiratory problem because of during this season, he or she should go to the doctor, specialist in the hospital or in clinic where proper diagnosis will be made, and accordingly the treatment will be given.
our nose and mouth are the entry points when we breathe. So it's the nasal and the throat part which are the first ones to get affected with the pollutants. One school of thought is that even when there isn't much pollution, one should continue with such measures like gargling or maybe jalneti in yoga, or some specialists even say it's an old traditional home remedy kind of a thing where you put 2 drops of oil, almond oil at night in the nose so that the passages are cleared regularly, and that strengthens your system. How much do you think one can take recourse to these home measures and alternative therapies?
You see, actually, yoga is usually recommend the yoga for the well-being of the respiratory system. But really, if you do it in an atmosphere where a lot of pollution is there,
Yes.
definitely it will be hazard. If you are regularly doing yoga for a long time, that is, you continue, but not in the atmosphere where the pollution is high. That will be detrimental, more of the detrimental.
Right.
And second thing is the putting up of the oils on anything into the nose or doing a mouth gargle with anything. That is not actually recommended frequently. Only what if you have any sore throat or
Okay.
any nasal irritation like that. So only thing is that you have to go to the doctor. He will prescribe you a medicine which will give you the symptomatic relief, like some anti-allergy. But self-medication is not. At the most, if you have lot of sputum production coming out, and you don't have any fever, but like a small amount of sputum is coming or a lot of sputum is coming. Only steam inhalation sometimes helps in taking out of the sputum to clear out the chest. But ultimately it depends what is the diagnosis of the disease. So that has to be there. That's why one has to go to the doctor for the appropriate prescription, like for treatment.
Yes, steam inhalation you mentioned is a very effective remedy, especially in the beginning stage of irritation in the throat or the nose, because that I believe that the strong heat helps kill the virus, perhaps. Is that one would infer from?
Actually, steam inhalation, what it has is it helps to take out your secretions. If there are thick secretions, they are melted, they become thin, and they can be easily taken out of the chest, of the nose or mouth. That is the only help you get with the steam. But too much steam is also not good.
That's a very valid point, because some people recourse to these things in a regular manner, and of course, as you said, it might harm.
You need to go as per advice of the doctor.
Doctor, let's talk about the role of building up immunity. I always say that let's invest in ourselves when the going is good, because as you said, when the pollution level is high, even if you do pranayama or yoga, it might be detrimental because you have pollution all around you. So when the going is good, how can we build up immunity through, let's say, nutrition? You think vitamin C will help? And if yes, then are there tablets to build? Because after COVID, everyone was talking about vitamin C and immunity building measures, and immunity building stuff came in the market, bombarded the market. How can we invest in building in our immunity system, particularly either through some tablets or some medicines or through diet, nutrition?
The people who are normal and healthy, and not only at the extreme of age, young patients, they really a person who is sleeping well, taking food, normal diet, natural diet, their immunity is not compromised. So we usually, in a patient who is taking his diet normally, we don't prescribe any multivitamins. So multivitamins and the vitamin C are required for the people who are already having some underlying diseases and whose diet is compromised because of the disease or for any other reason. Only in those cases we prescribe the supplements, vitamin C or multivitamins, to boost up the immunity. Otherwise, any person who is taking good diet, taking good sleep, and don't think that they require any immunity system. And there is no such injections or anything which will boost the immunity in a day.
You actually raised a very important issue of sleeping well, and as they say, 6 to 8 hours sleep. I think 6 to 8, if I'm not wrong, because that is the time when your healing happens, your systems take rest. And also you touched upon a very important point of natural diet. In our lifestyle now, the junk food has invaded our lifestyle, with all kinds of processed foods like biscuits and chips, and children are addicted to it. And they don't realize, but it has a secondary harm, which is because it's got so much salt, it's got so many chemicals as preservatives, and of course it's processed, and you don't know what kind of oil is used. All that also helps lower your immunity, and you are vulnerable to attacks by the pollutants around you, right?
Yeah, definitely. Yeah. These are what we have mentioned, junk foods. We have our children and young population are used to all these. They like junk food like burger and pizzas and all this.
Yes.
Yeah, definitely they are not very healthy, basically. What happens, they have a lot of excessive salt and some preservative also they use. So it is better to avoid this. And stick onto the natural food basically.
You're right. Some people even attribute white sugar and too much of white salt also not good for health, and it lowers immunity. Doctor, let's move forward. Let's talk about indoor pollution. We have paints around us. The walls are painted, and it is said that when light falls on these paints, they emit lead. Is that true or not? There are lead-free paints, I believe now, but there is something called indoor pollution, or is it just a whimsical thing?
Definitely, there is a terminology called indoor pollution, and the nature of indoor pollution is different from the outdoor pollution. So, if I talk about the outdoor pollution, its constituents are different as comparison to the indoor pollution. Like if we are using in the kitchen, if we are cooking food, if we are not using any exhaust, that oil starts will be circulating in the house. So that will have a different impact on the respiratory system, different adverse effects in comparison to the outdoor pollution. And like many people smoke inside the house, and they are creating a smoke area. So it also comes to the indoor pollution. And if we are using the paint, like it has a lot of smell. Anything like if we are using perfume of like different smell,
That's
like
right.
chemical smell,
That's
they
right.
will have the ill effect on the respiratory.
We have room fresheners, we have agarbattis, we have wood polish also. All these must be carrying chemicals, many of them at least,
Yeah.
if not all.
There are many types of paints are there, but not all smell. So if any chemical which is emitting, which is having smell and it is coming out of the face, definitely any chemical will have the ill effect on the respiratory system.
And coming back to outdoor pollution, Doctor, do you think that the government needs to have a policy of, we have some wonderful plants and the government should move in the direction of planting more such plants like neem, which has a great purifying ability. We have people which gives oxygen 24 hours. We have tulsi. Do you think we should invest more in these plants at whether inside house or outside house and maybe create more carbon sinks with many trees in a cluster as a small mini forests in the city? Do you think such measures can be of any help?
Definitely, plants are very helpful. They take up the carbon dioxide, release the oxygen, and definitely they fight, they are very helpful in the air pollution by decreasing the harmful particles. So, government is always already proactive about it. Plantation is going on everywhere.
Yes.
Recommended it, and deplantation has to be avoided basically. Cutting the trees, that is very important. We should avoid it. Like we say, save paper, save earth. So definitely we are using wood, plants for our own interest.
Right.
No, at the cost of atmosphere. That should not be there.
Yeah.
Definitely it is there.
So at the policy level, we can have more trees. At a personal level, nothing can be, we can't leave everything to the government. At a personal level, we can have small pots and some plants which are supposed to be indoor friendly and emit oxygen inside the house, and they don't need much care or sunlight. They just, but they grow well, right?
Definitely,
Right.
we should all do the plantation surrounding our houses. That is always good.
Doctor, what is the role of air purifiers? We had talked about some vulnerable groups in the beginning, like people with asthma or old people or people with some comorbidities. What is the role of air purifiers? Do you think they actually help in reducing air pollution inside the house?
See, air purifier basically as a normally for the normal person who don't have any disease, any comorbidity, may not have any good effect. But definitely, if you can do something for the person who are having comorbidity, already having respiratory compromise, so it may benefit. But that's too early to say regarding this. We need more, we need more time
Research?
to say that how much they will be effective.
All right. Thank you so much, Dr. Pavan, for talking to us and telling us on how